Hello and welcome to the Newsmaker interview series here at Patrick Henry College. Today we have the honor of welcoming Dr. Camilla Hersh. Dr. Hersh has been the owner of Virginia Women's Health Associates since 1992 and consistently lands on the Washingtonian Magazine's list of top doctors. Dr. Hersh has delivered over 4,000 babies and was one of the first physicians in the DC metro area to offer Da Vinci robotically assisted surgery. She's also a clinical assistant professor at Georgetown University Medical School. Please join me in welcoming Dr. Camilla Hersh.
Well, thank you for coming to the first ever Saturday Newsmaker interview. And thank you all for coming here. We have a lot to talk about, but let's start with your background and why did you decide to become a doctor?
Well, thank you for inviting me, Marvin. I think I decided to be a doctor when I was in junior high school. I enjoyed science, and what I didn't know the topic at that time was physiology. I just thought it was science. I enjoyed the science of the human body, and I enjoyed working with people. So that, of course, suggested perhaps a career in medicine.
Okay. And then you went to the University of Michigan in a program for both undergraduate and medical school, a 6-year program?
I did. At that time, Michigan had a pre-medical medical program where you're accepted into medical school right out of high school. And then we went to school year-round, so they kind of made up the time and compressed it into a shorter period of time.
And did you have pro-life convictions when you first came there, or how did that arise?
I think in general I did, Marvin. I recognized, even before my faith became an important part of my life, that life begins at the beginning, and that Hippocratic oath of first do no harm really spoke to my soul, that I could never be a physician that ended life at any stage.
And your medical training, did that include at that time, we're talking here about the early mid-70s, so Roe v. Wade is in 1973. Did your medical training include abortions?
The medical training of any obstetrician gynecologist includes the technique of how to empty a uterus. I always chose the cases where the baby had already died. There are plenty of sad cases where the baby has died already, and you need to use the same technique to empty the uterus. So I was not required. At that time, one could decide whether to or not to participate in ending life.
What's it like now, as far as medical training?
I think it depends on the program, Marvin. Many university programs require, when a physician finishes medical school and is applying to residency, that they are required to participate. Many allow the young physicians to opt out. And some programs simply do not provide elective termination of pregnancy. Again, the required ending of a pregnancy if a woman's life is at risk or the baby has died, there are enough occasions where that sad occasion comes up that one's training is not compromised.
So there are some programs that do not have an opt-out. Is that right?
I believe that's the case.
And is that a tendency do you have any sense, is that growing? In other words, in terms of the religious liberty that's now afforded prospective doctors, is that well understood, well maintained, or is there pressure to disallow that?
I think there is a pressure from the standard professional organizations to require abortion training and abortion participation. I think still probably at least half or a third of programs across the country don't take it upon themselves to strictly enforce that.
Okay.
From what my students tell me, from what my residents tell me.
Okay. And what about for nurses? Do they have any religious liberty options?
I'm not really well versed on what American Nursing Association requirements are. I think, again, that's probably individual institutions. I know that there have been cases in the last 5 or 10 years where nurses have declined, been threatened with job loss, and have had to go to court to maintain their rights.
Okay, so that's a fight that's continuing to be able to do that.
It is, and pharmacists too. With some of the oral abortion pills, if a pharmacist, if someone comes in with a prescription for Ella, for example, which is an abortifacient medication, if you're a pharmacist, do you fill the prescription? So there are pharmacist rights issues that are also ongoing.
Okay, so what year did you deliver your first baby?
Well, I guess it would be 1979. As a third-year medical student, or a standard translation of medical student, the first 2 years of standard medical school are classroom, and the second group of 2 years consists of various rotations into the different specialties. So you might spend a month on internal medicine, you might spend a month on general surgery, got a month on pediatrics. So I had my month on obstetrics and gynecology, and so I was allowed and helped. I felt like I was delivering the baby myself, but I'm sure that the senior doctor was there kind of making sure I didn't drop the baby. But that would have been 1979.
So I'm wondering, I mean, the saying is, you always remember your first kiss. For example, do you remember your first baby?
I do remember the first baby.
Okay, and you didn't drop the baby?
Didn't drop the baby.
Okay. And now since then, the introduction was 4,000, but I understand actually it's more than 5,000?
It's actually 5,000 since that CV was written, yes.
Okay. Okay. Does it become old at this point, or?
I have to tell you, it never becomes old. One of my favorite phrases is, in obstetrics and gynecology, I get to specialize in happiness. I get to see a mom and a dad on the first time they see the face of their baby for the first time. And that never gets old. Quite often, it's just a normal biological delivery. Sometimes you need all the skills they sent me to school for. It's an honor and a privilege to be able to help greet new life.
So you can specialize in happiness, but sometimes there's unhappiness.
Oh, yes. It's either very, very happy or it's very, very sad. If the baby has died or there's a sad complication, or if in my gynecologic practice I find that someone has some kind of cancer, when it's happy, it's very happy, and when it's sad, it's dreadful.
So is there a particular example you could tell us about or I was going to ask about a very happy situation, but are all happy deliveries, to paraphrase Tolstoy, are all happy deliveries similar, or are the unhappy ones all different?
Oh, they're all different, and that's why I still do this, and it's never
Okay.
boring, because every single case is different.
So what's a happy, let me ask you about a happy memory that you have of this, and then I'm going to ask you about an unhappy one.
Oh. So many happy occasions. Well, I think even more happy than usual is if I've had a patient who has had what we have found to be unsurmountable infertility. They've had every test in the works, and just with their particular body, there's going to be no baby. And then every now and then a miracle occurs, despite all of our dour predictions. So I had a family who they had 3 adopted children, wonderful adopted children, and the woman comes to me, and we were pretty sure that she was going through premature menopause because her periods had stopped. And so we were, I was examining her, and it seemed that perhaps I thought she might have fibroid tumors of her uterus because her uterus was enlarged. And so I got the ultrasound out and said, well, goodness, well, we're probably going to have to talk about hormones in pregnancy. And she was saying, I feel so tired, and I feel like I have the flu. And And then I was pretty sure one of the fibroids moved. But it wasn't the fibroid at all. It was her baby, who was 6 months along, who was actually had snuck in despite our negative predictions. And so, of course, when that baby was delivered, her adopted children, who were now teenagers, were able to be at the birth. That was a really beautiful delivery.
And so C.S. Lewis's autobiography titled Surprised by Joy.
Yes.
So there's a theological joy, but there's a joy of that sort. Now, what about surprised by sadness?
Well, probably across the country, 1 in 100 babies are stillbirth. But in a population of patients that I care for, who generally are non-smokers, exercisers, taking their vitamin every day, a stillbirth occurs maybe in 1 in every 200 or 300 births. So when someone's gone all the way through pregnancy and the baby has seemed fine, and we go to check the heartbeat and the baby has passed away, that's unspeakable.
So I'm wondering about OBGYNs. I mean, because most OBGYNs, would it be right to say most OBGYNs do abortions?
No, actually, it's interesting. No? Most people think that obstetrician gynecologists do. But as you know, I'm part of the American Association of Pro-Life Obstetrician Gynecologists. Try to say that 3 times in a row.
How about saying APLOG?
APLOG.
Okay.
And we take surveys occasionally, and we find that probably less than 10%
Okay.
of obstetricians, because generally most people that go into OBGYN, even if they don't have a particular faith foundation or a particular thought about abortion or doing or refusing, most people go into OB because of the happiness. They do. And it's unhappy when someone feels like they need to end a pregnancy. It's a sadness. And then to be the one who, with their own hands, ends the life of a growing baby, it's not something you'd get up on a Monday morning saying, oh, great, I'm going in to do 4 abortions today. So most obstetrician gynecologists decline to do them. Many refer to an abortion center.
Okay, so you have 3 grown daughters, right?
I do.
One granddaughter.
I do.
Okay, they bring a smile to the face just thinking about them. But what about the people, the OBGYNs who do abortions? I mean, they have often children and grandchildren, and yet, I'm sure you've had lots of discussions with them over the years, and it just seems so strange to be able to do that.
How do they live with that?
Yeah.
Well, I think you'll find that the most common explanation is that they feel that the patient is going to have this done anyway. She's decided to do it anyway. And there are some dreadful complications if it's done badly. And so they feel like they're protecting their patient from the complications.
Okay.
Although it's interesting, when I was at Michigan at that time, one of the professors was, his specialty was late-term abortions. And he was speaking at a conference, and someone in the crowd stood up and said, we'll call him Jim. His name isn't Jim. Maybe he's changed his positions, and I don't want to speak badly of anyone. But they said, so Jim, everyone in the crowd wants to know, how do you feel when you do these late term? I mean, we're talking into, like, at that time, 27, 28-week babies, so 7 months along, really. Babies that if you deliver them, we would send to the intensive care unit and would do well. So he said, well, Jim, how do you feel when you do this? I mean, and he was very interesting. He was very, very honest. He was double boarded in OBGYN and psychiatry. He said, if it was you asking, he would say, Marvin, it is very, very troubling. And at certain times in my life, it's been very troubling. When my wife and I were expecting our first baby, and if I was doing a termination at the same gestational age that our baby was, that was very troubling for me, Marvin. Everyone in the room sat there going, I thought he was lacking in the ability to feel the same things that you or I might feel if you put on the brakes when a squirrel is going to cross the street. You try not to kill a living being. I think it's built into our nature. But no, there was nothing wrong with that part of him at all. So I think most practitioners who do abortion feel like it's a necessary sadness to prevent the serious complications that can happen from abortion.
Okay. One of the striking things in what's been very much in the news concerning the Planned Parenthood videos is the way, at least, the folks selling baby parts, don't seem to regard these even like a squirrel crossing the street.
Mm-hmm.
There's a certain, when you see those, and you in a sense know it from the inside. What's your perception of those videos?
I think I'm equally horrified as anyone. Have you guys seen the videos? Again, you think surely this must be troubling, but when to any practitioner, you would think, well, it's a necessary sadness. But I think the abortionists that they are filming have become numb to the process, and frankly, there's a profit to be made. I was watching a news presentation about this, and a fetal liver, for example. So you know how some of the videos, we're going to crush the head or crush the limbs so we get the central body organs intact, and then we can sell them piecemeal. But the group to whom they sell them, do you know how much fetal liver costs from STEM Express on their website menu?
Tell us.
Somebody give me a guess. Throw a number out. Say you were a scientist working on some project and you just needed to order some fetal liver cells.
So you're
$400. $24,000 and some change. So, and when they were interviewing the CEO of STEM Express, and they said, well, what, undercover, and they said, well, what could we do for you? What could make you happier? She said, 50 more livers a week would do it. And so it's horrifying, the profit to be made. I think everyone regards abortion as at the very least, as a sadness. It's a failure. It's a failure of a relationship. It's a failure of someone's hopes. It's not a positive topic for anyone, no matter where you stand on the politics of it. It's a failure. But to have companies making such a profit, it is reminiscent in some ways of German scientists. Joseph Mengele in Germany did some very interesting double-blind studies on twins. So if your society has said, here are some human beings that are going to be killed anyway, shouldn't we learn from them? There's a macabre practicality of it. This is tissue, it's available. Why should we waste it? Shouldn't we do cold water drowning experiments on prisoners? Shouldn't we find out how we can transplant their organs to one another? Horrifying practicality among very, very polished and educated scientists in Germany. So similarly, there are many, many experiments that if you had actual human cells, and they're there anyway, should you not use them? So you understand the practicality of it, but it is horrifying when someone's eating lunch and drinking wine and laughing about what really, at least the very baseline, is one of the most tragic sadnesses of our human existence. That someone, what did Mother Teresa say? That it is a poverty that a child must die so that we can live as we like. It is a poverty. It's a human poverty.
So if someone who from Planned Parenthood says, well, here's the logic, here's why this child's going to be dead anyway, I wouldn't say child, but how would you respond to that if you're sitting down with a Planned Parenthood person?
There is enough spontaneous loss of life that you can donate your organs to take someone's life. And really, especially as treatment of premature babies becomes more and more successful, the individual whose parts are being sold themselves does not give consent. If you wanted to donate your kidney to her, say you have a horrible disease and you happen to be a match, and you're a nice enough person that you say, well, I think I will donate my kidney. You can do that. Or if you pass away, I hope you all have signed your driver's licenses that someone can use your eyes and your heart and your kidneys and your liver. You're a nice person to donate. But if someone robs you of your life and also sells your organs, what kind of people have we become? Mm-hmm. Another similar example, if you're ever in an argument with your friends, there's a group called China Watch that has documented Chinese prisons. Once a week or so, the organ bookmobile, if you will, drives up to the prison and then leaves with the typical medical suitcases that contain organs. And so apparently when you are convicted or put in prison in China, they draw your blood, they check your HLA type and your blood type, and if you're a match, suddenly your crime becomes a death penalty crime, and they harvest your organs. It's very interesting. So I think it's helpful to take it out of the context of the emotionally charged political topic of abortion and say, to use human parts, what are the necessary ethics involved? Someone has to voluntarily give their parts, even if they're dying, and then those parts need to be used in a respectful manner. But to take someone's life and then rob their bodies of their parts, and then target what kind of death you're going to expose them to, it's just macabre.
Mm-hmm. Let me ask about a few other macabre things. The arguments in favor of RU486, saying, well, this actually is going to, in some ways, make it easier, more convenient for women who would be having abortions anyway. I've heard that argument. Mm-hmm. How do you respond to that? And perhaps if you're not familiar with RU486 and the way it works, maybe you could go into that a little bit.
Well, it's what we call, or what is called, a medical abortion. If you were going to have an abortion, you could go to an abortion clinic and have a surgical abortion, or you might be given the option of a medical abortion, where it's not just RU486, but it's a 2-drug poison, where you take a medication that blocks the progesterone receptors at the baby's placenta, so the placenta can't function and the baby can't get any oxygen and dies. But then meanwhile, the body has to expel the remains of the pregnancy. So then the woman is also given a second drug, mifepristone, which makes the uterus contract so that she has a miscarriage. So on the one hand, it seems easier, right? Take a couple pills, not pregnant. But the experience of the RU46 abortion is really perhaps worse, because you have extreme cramping, heavy bleeding, hemorrhaging, and you pass the visible baby alone in your dorm room, in the toilet, and meanwhile you're bleeding. No one knows that you need help. So actually the complications that can occur are far worse. There have been hemorrhages to the point of death, hemorrhages that need blood transfusion, all the things that they proponents of abortion say, oh, abortion should be safe and legal and all this clean environment, but they won't let them legislate to have a clean environment and have the same standards that any other clinic or even a veterinary clinic has more standards to meet than an abortion clinic. And then there's a horrible complication that can happen because the RU46 also blocks your immune response. So say you, sir, you have a sore throat. You run a fever, your glands swell, everybody knows you're sick. You go to the clinic and they say, oh, this one looks sick, we should do some tests and give him some medication. But With RU46, it blocks some of the immune response. So if someone is having a very serious infection, which with anything else, you would look sick, you would act sick, your temperature would be 105, your roomies would take you to the ER. When someone is sick with a sepsis after an RU46 abortion, they look fine. They're pink, they don't have a fever, their white blood cell count is not elevated, and so they look falsely normal. And meanwhile, their severe infection is galloping along. And so there have been several very terrible deaths from sepsis that was unrecognized because of that particular side effect from it. So it seems like an easy answer, but it is not.
So very dangerous for the women involved, and also you're suffocating the baby, right? That's essentially?
Yes, cutting off the placental supply.
So suffocation, is that more humane than cutting up, chopping up? It's a strange calculation that is sometimes made.
It is a strange calculation.
So let me ask another thing that's being discussed. Ella, you mentioned that before, and tell us about that, and what are the problems with that?
They're very similar. They're similar to the RU46.
Okay.
It's more an antiprogesterone, acts earlier, has to be given earlier in pregnancy.
Okay, but similar in that way. What about there are now something sold as very long-acting forms of birth control. What's going on there? I mean, that's another thing that's being sold as a panacea to make rarer.
It is.
Yeah. So
some of them are sort of, probably most are morally neutral.
Okay.
There is a device called Nexplanon, which is a matchstick. I know none of you smoke and don't know what a matchstick looks like, but a matchstick-size plasticky silicone material that's slipped under the skin, and it lasts for 3 years. For the first 2.5 years, it generally blocks ovulation. But in the last half a year, it does look like the ovaries wake up and they ovulate, so then we worry about whether its action at that point is more from the effect of the progesterone at the lining of the uterus, or the lining of the uterus is too thin for a fertilized baby to implant, or if it's instead the effect of the progesterone on the cervical mucus that acts like a little plug. So if someone is thinking about that, I tell them maybe think of changing to something else at 2 years, because you're still not ovulating. Waiting for that 3rd year, you may theoretically miscarry some children, and so most people want to avoid pregnancy by not getting pregnant in the first place and not by having an early miscarriage. Similarly, there are a number of intrauterine devices. Some are simply a piece of plastic wrapped with copper. Some are a piece of plastic embedded with a type of progesterone, and they work as a biological spermicide for the most part. If you look at an IUD that's been in a uterus, which sometimes we do, if someone has an IUD and they've lost the little string to check if it's there, we have to go into the uterus with a camera and look around and find it. So the IUD is surrounded by white blood cells. Think of it like a large splinter. You know, you've had a splinter in your finger, and you can tell it's pussy around there because it's yellow and weird, and maybe the skin grew over it and you can't get it out. You have to go and have someone take it out. So it works as a biological spermicide, and for the most part kills the sperm. Now, occasionally a very valiant sperm gets past the pussy red raw environment inside the uterus. I know it's just after lunchtime. I'm sorry to be talking about these things, but he asked me the question. So occasionally conception can occur, and then the little fertilized embryo has no safe place to implant, so it passes as a very early miscarriage. And again, most people want to, when they're planning their families, want to avoid getting pregnant in the first place and don't want to plan their spacing of children by miscarrying occasionally, so that's sort of an unpleasant one. Now, the ones that have progesterone, also work mainly as a biological spermicide. But because they have progesterone, they make the lining of the uterus thinner, and they also make the cervical mucus thicker. So it does act as a little bit of a barrier. So many people feel like they are not contributing to an abortifacient factor. I think it's too hard to figure out, so I don't participate in the use of those. But usually when I describe the whole splinter pussy kind of thing, people decide on something else. Because do you really want a little pocket of pus inside your body? Even if you didn't care about life issues. So many of our illnesses relate to chronic inflammation. If you have a chronic inflammation of your lower esophagus, it's called Barrett's esophagitis, and that chronic inflammation puts you at much increased risk for esophageal cancer. A lot of our rheumatological illnesses are from chronic inflammation. I just think medically it's not a good idea to purposefully put a chronic inflammation in your body.
One of the things that pro-life groups have been successful politically and legislatively in doing, I mean, within the regime imposed by the Supreme Court, were actually two things. The requirement for ultrasound and also the requirement for informed consent. Now, what are the arguments that OBGYNs on the other side use against that? I mean, these are things I just don't really understand because it seems to be very basic information. But yet, this is seen upon by some people, looked upon by some people as a very invasive legislative requirement being imposed on women by pro-life fanatics. I'm just not sure. I'm not clear on the arguments against it. Are there valid arguments against those?
No, I really think that that's an area where there are no valid arguments.
Okay.
Everything we do in medicine has informed consent. Even when my daughters had their ears pierced, it wasn't even a medical clinic. I had to sign a consent form. When I realized that my dog has more rights than young women do, when she actually swallowed an entire bone whole, and it was puncturing her stomach. So we took her to the vet, and they were going to do surgery. So there were these informed consent forms, and I had to smile, thinking that if my daughter had been going in for an abortion, she wouldn't have required in many places my consent, or even if you were 21 years old and went in for anything medical, you have to sign a consent, and you have to go for a pre-op visit. I do a lot of interesting surgery. You should come and watch me operate. All of my patients in whom I'm going to do anything, I have a 3 or 4 page consent, and we go through that process several days to 2 weeks before the procedure, so that they can have a chance to think about it, ask their questions. They need to fully understand. But if you go in for an abortion, somehow you're considered too emotionally upset to understand an informed consent, which is ridiculous, and I think very insulting to women, that we're too frail to read an informed consent form.
So what are parts of understanding concerning abortion that the mainstream media really neglect? I suspect there are a few, but what would you think are the main ones that really should get press coverage and haven't gotten press coverage?
Well, a number of things, Marvin. That if it was any other topic, would be very exciting topics for the press to cover. Complications from abortion are still very serious. Bleeding, infection, damage to internal organs. There are, every year, several women die who have abortions at abortion centers, and there's never any provision for continued care at an abortion clinic, or rarely, and never say never, but rarely. And so when someone has a complication, they come to an emergency room, and someone like me, whose turn it is to take care of the emergencies today, tries to treat the complication. But in our hospital just 6 months ago, someone came in, it wasn't my case, that had had a late-term abortion and was hemorrhaging, and the doctor who was on call took the patient to the operating room, and she had 8 lacerations in her uterus, 8 stab wounds. Not one. With any procedure that we do inside the uterus, there's a 1 in 100 to 1,000 chance of a perforation. 8. How do you lacerate 8 times? Anyway, the poor woman, she was only 23. She had to have a hysterectomy because her uterus was so ruined. So she not only lost the baby that she aborted, she lost her uterus as well. So complications that lead to death, that would be an expose that's kind of covered up because it's unpopular to discuss such a thing. The suicide rate, if you go to the APLOG website, there's a list of papers and very well documented with peer review resources or references. But the suicide rate after an abortion is very, very high because the person is troubled. She feels her whole friends and family have aborted her. The suicide rate is 40% higher in the first year after an abortion. And the biggest study that documents this was done in Scandinavia, where they don't have as many political disagreements about abortion. The risk of premature birth. For every abortion that a woman has, her risk of having a premature baby goes up 30%. It's 30% higher with the first one, it's 60% with the second one. It's a dose effect. It's like 1 Tylenol will bring your temperature down by a certain amount, and 2 Tylenol will. And the complications of prematurity are huge. Does anyone have friends with cerebral palsy? You've been in the mall or at church, and you see someone who's in a wheelchair with cerebral palsy. Now, quite often their brain is working fine, and they can be very brilliant, but they're permanently disabled. And cerebral palsy is one of the worst complications of extreme prematurity. And if that could be prevented even by 50%, that should be part of the informed consent process, and even it should be publicized, because quite often someone's had a pregnancy loss. In any group, 1 out of 3 women at least have had an abortion. It seemed like the quickest answer at the time to solve a problem, and even when you're a few years later and you're at a more mature place in your life, you wish you hadn't done that. Nevertheless, that's what happened then. But you should know that when you do have your subsequent children, you're at a little higher risk for premature labor, and your doctor should watch for it. You should watch for it. We have a lot of things that we can do to intervene and stop a premature birth if we knew it was a risk factor. It's a little controversial, the link to breast cancer, but it does seem that if you end a pregnancy right as the breast cells are rapidly developing in an early pregnancy, the mother's breast cells, and you suddenly stop that development, you have a lot of cells that are in an immature stage. And those cells kind of go dormant and are more likely to be available for the precancerous changes, for whatever it is, that many factors, I'm sure, that trigger breast cancer. And then particularly if you add to that, if your mother has breast cancer. So say someone is 20 years old and they have an abortion, but meanwhile their mother at that time is only 45. So she doesn't know that her mother had breast cancer because her mother isn't going to be showing breast cancer till she's in her early 50s. But if you are younger than 20 and you have a termination of pregnancy and your mother has breast cancer, that increases your risk by about 90%. That study was done by a non-pro-life physician who actually, Martha Daling, I think her name was, who got a lot of flack for publishing this paper, that it's like a trifecta of risks. But shouldn't we know the risks? Shouldn't we as women and men who love women know that there are risks that if 1 out of 3 of us has had an elective termination, and 1 in 8 women is going to have breast cancer sometime, that's going to be a pretty common risk that you had an early termination and then your mother had breast cancer. You should know you should be screened earlier, sooner, more frequently. Let's take it to another topic that's not abortion related, colon cancer. Everyone loves to talk about colon cancer on a Saturday afternoon. But 1 out of 16 people is going to have colon cancer. But if your mother or your father had colon cancer, we screen you sooner. Typically, you go for your first colonoscopy at about age 50. But if you had a first-degree relative with colon cancer, we screen you earlier. We just screen you earlier. So heaven forbid you're the one, we find it sooner. Why must we? It's kind of like there's an involuntary blinder. Any risk that occurs with abortion, we're not allowed to hear because it's a political hot topic. And so the risks that are that's the facts of science, risks, we should all know so that we can protect women and their children from the risk of prematurity.
Okay, I asked about what mainstream publications don't cover. Let's look at publications like World Magazine that are pro-life. What should we be covering or doing a better job of covering than pro-life publications are generally doing now? What do you wish you would see more of?
I think you're doing a pretty good job already. However, I would say just continuing to be the global support mechanism. Sometimes when you're, on a campus like this one, you probably have a lot of support for life-affirming values, but with other friends, don't you sometimes feel all alone? And our media makes you feel like you're all alone. And don't you sometimes feel like you're the only person that sees that the emperor is naked? Remember the story, the emperor's new robes? Some things are so obvious, and yet we increasingly have to behave and live in a counterculture. So to be a support mechanism to broadcast that it's normal to support life, it's normal to support health, and to have easy access for students and for people all over to quickly get the data. Sometimes someone asks you a question and your mind goes blank and you go, I know there's a reason and a science, but I'm going to have to look it up. And one of the wonderful things about internet availability of information is you can look things up very quickly, but you want to base your opinion in science and logic and law. And so I think keeping the resources available so someone can quickly find their answers for those difficult questions.
Okay. Questions from some of you? Difficult questions, perhaps.
So,
Yeah.
if you have a patient, when the patient fills out the patient information, do they mark if they've had previous abortions? And do you find that women are willing to reveal that to you?
In general, I think most people are honest. It's just part of the gynecologic questionnaire. How old were you when you first had your first period? Does anyone in your family have breast cancer? How many pregnancies? Spontaneous losses, elective losses, ectopics, births, complications of births. It's just part of the information that is on every form. Now, sometimes I'm sure because of the sadness of the circumstances, I'm sure there are women who just don't write it down. But usually they talk to me about it. I've had a number of patients say I didn't want to write it down, but I had one loss.
And so if someone comes in and has had a previous abortion, but it is now pregnant and wants to carry to term, what would you do differently for that woman?
I myself watch a little more carefully when we hit the time of pregnancy where premature labor occurs. I have her come in a little more often. I check her cervix sooner. so that in case she is looking like she may have preterm labor, there are a number of medications that we use to enhance the maturity of the baby's lungs and to enhance the maturity of the baby's brain to prevent cerebral palsy. There are a number of things that we can do to limit the consequences of those things. Someone had a question.
Hi, thanks for coming. So you mentioned that you kind of explained how abortion can increase your chances of breast cancer. Do you believe that there's a link between birth control in general and breast cancer?
No, I really don't. There were a couple of studies in the 60s that showed a link. Keep in mind that the dose of the birth control pills in the 1960s were 8 times higher. So the women in the 60s took basically 8 of current pills. It's actually 10 of the lowest dose pill, 8 to 10 pills a day, and there was a rather high incidence of heart attack, blood clot, stroke, and there was one study that showed an increase of breast cancer. In the studies that have been done since then of doses half to 2/3 of that, and again, much more than are currently used, there hasn't been shown an increase.
Frequently, when we're talking about pro-life issues, people who are in favor of keeping abortion legal will say, well, if you criminalize abortion, then you'll be cutting off the ability to abort babies who are the results of rape or pregnancies that could harm the mother's life. How frequently do you actually see that in your practice?
Pregnancy as a result of rape, or pregnancies that seriously affect the mother's health?
That could be solved, or the mother's life could be protected by aborting the child. How frequently is that?
Happily, that is unusual, but probably every 5 or 6 years in my kind of a practice. I can share some sad stories. I've had a couple of patients where the baby's little amniotic sac has ruptured too soon and an infection has set in, and the mother's white count is elevated and she has a fever and her uterus is tender, and basically that's the onset of sepsis, which if untreated, she will die of sepsis, no matter what antibiotics you use, because antibiotics don't really affect the chorion, the little lining between the baby's placenta and the uterus, very well. And so in order to save the mother, you have to evacuate the uterus, so that technically it's a type of abortion. I was sharing with Marvin, we had a sad case 5 or 6 years ago, a woman who was 18 weeks along. Usually we can save the baby at 24, 26 weeks usually. It's getting closer to 23 now in some studies. So really, if we could just get this lady a little farther along. But she was 18 weeks and the placenta was bleeding. And the uterus, which at 18 weeks should be maybe football size. You guys like football. Instead, it was beach ball size, full of blood. But meanwhile, the baby's heart was still beating. The baby was still moving around in there. But we'd already given the woman 6 units of blood, and a woman her size only has 4 or 5 units of blood. So we had already replaced her whole system. The blood was coming out like a faucet. And I had to do a dilatation and evacuation to save her. And it's a little bit like being a fireman, I suppose. Not that I wouldn't pass the physical to be a fireman, but if I were a fireman, and I went into a burning building, and I could put you and you over my shoulder and drag you out, but one person had a beam over their torso, and I couldn't get him out. I really would have to save the people I could drag out, even though my heart would break forever, wishing I could have saved the person that was trapped. And so when we have a case like that, I do have to empty the uterus, I do. And I think about it for years, and it brings me to tears. If only I could have saved that baby. If only I had an incubator small enough to put that 18-weeker in. but I didn't, and I don't, and I won't for 100 years. So there are some situations that do occur, and an obstetrician gynecologist has to do that to save someone's life. But I did save one life, and she just had a baby about 6 months ago. And we love that baby, but it won't bring back the baby we lost. It won't bring that baby back. Other questions?
We hear sometimes about ectopic pregnancies. Maybe you could explain what those are and the circumstances then.
Well, an ectopic pregnancy is where the baby who has formed as the egg and sperm meet in the outer portion of the fallopian tube, instead of rolling all the way down and landing in the uterus, gets stuck and implants in the fallopian tube. There are also other places, there are other spots where a baby can implant on the intestine, rare places. But typically an ectopic pregnancy is where the baby has landed in the fallopian tube. Now, most of the time, the baby miscarries there because as the baby grows, it's the wrong place to grow a baby, and so the fallopian tube tears a little bit, and the area around the baby hemorrhages, and the baby dies. Most of the time when we diagnose an ectopic, it's there, but there's no heartbeat. So we have to go, and depends on how far along the baby is. If it's a tiny, very early pregnancy, we can use medication, methotrexate, to basically destroy the placental cells, and the body clears up the remains of the baby on its own. Sometimes it's actually bleeding and making a little lemon or tennis ball size bleeding mass. So we can go in laparoscopically and make a little incision over the fallopian tube and evacuate the clot. Occasionally the heart is still beating. In 30 years I've seen that twice. Again, rare. Most of the time, by the time we diagnose the ectopic, the baby has died just from landing in the wrong circumstances. But it's one of those things where we can't transplant the baby somewhere. If we could, that would be very exciting. But again, we need an embryo, or not an embryo, we need an incubator that can take a tiny, tiny baby. But I don't think that's going to happen even in your lifetime.
We hear politicians who are largely pro-life saying, well, yes, except in cases of women's life, which we've already dealt with a little bit, but also rape and incest. How do you respond to that?
That's a hard one, isn't it? I think that if we're going to do that, you'd have to argue for capital punishment for the rapist. So if we're going to make rape a death penalty issue, if your life is the result of rape, and so the society says we can end your life, perhaps the criminal should also face the death penalty.
Right.
I say that a little tongue-in-cheek because, I don't know what I really think about the death penalty. But I think it's an interesting thing to say that you're solving a crime by killing a victim. And now, I guess I would understand it if the legislators voted that way. I would like to think that society would imprison the perpetrator and provide life-sustaining situations for the baby who's a victim. Incest is an interesting one. It's, of course, just a worse kind, an equally bad kind of rape. But I have an interesting incest story. When I first moved to this area, I worked with a big health maintenance organization. My kids were small, and I thought the schedule was going to be easier. Turns out it wasn't. But I didn't have any control over the procedures done or advice given in the large health maintenance organization. Well, one day, one of my colleagues from pediatrics called and said, I have to bring a patient up to you. We have this 14-year-old girl, and she's pregnant, and security's coming to arrest her father because when he found out she was pregnant, he put his fist through the wall and threatened everyone and threatened the girl and threatened the mother and blames everyone, and how did you know? So we need you to set up an abortion for her. I'm going, you haven't met me yet, have you? But I'm saying, well, why don't you bring her up, and then we start. Again, I have found it's always good you don't need to go full guns blazing right away when someone brings up a topic. Something else is going on. And in the same way when, most of you, I think, are believers here. In the same way, Jesus with his disciples, one of the first things he said was, "Come, follow me." And as they did, their lives changed. So I have found it in my life, a good thing to do is say, "Tell me some more about that. Let's find out how can we solve this problem?" So that's what I said to this pediatrician. I said, "Well, why don't you bring her up, and this is a hard one. Let's talk about it." So meanwhile, the young woman was, she was 22, 24 weeks. So technically, she could have had a late-term abortion. But we talked with her for a while. But when a pregnancy or a sexually transmitted disease is present, a minor, in many places, is called an emancipated minor and can make their own medical decisions. Like say you're 15 and you are having a baby and you need a C-section, you yourself still need to sign your permit for anything that happens with your child. So we talked to the girl, and her family was newly immigrated, recently immigrated from somewhere. And so we were talking to her, and we said, well, who are you having sex with? How, She didn't understand what intercourse was. So that's troubling. How did you get pregnant if you don't understand what sex is? So we got a little more information. And another physician was there, so it was part of the organization, asking her if she wanted to end the pregnancy, how did she want to do that. And she herself had just found out there was a baby in there. She just had an ultrasound. And she said, "Oh, you mean you'd kill the baby?" "I don't want to kill a baby." No. "I just want you to stop Grandpa from hurting me." So her parents, who were working like maniacs to try to eke out a living, the grandfather was doing the daycare, and grandfather was hurting everyone. So what the incest showed was not some kind of passionate, illicit lovemaking. It shows that there's abuse, illegal abuse. So the girl continued her pregnancy. She gave the baby up for adoption. She continued school, had a good life, and the law stopped grandfather from hurting her and her sister and her brother. They were all being sexually abused after school when the parents weren't home. So when incest occurs, when you say that there's a pregnancy as the result of incest, there's usually some horrible abuse that gets to be diagnosed and treated.
Yeah.
And to kill the victim doesn't really treat the crime.
Yeah. Any more questions?
I'm curious how many women, when they come to you for birth control, care whether the method is an abortifacient?
I think 2/3 do not care. But again, I softly help them understand their bodies, and I say, well, let's talk about all the methods that there are. So you can use time as a barrier. Natural family planning uses time as a barrier. We know our bodies so well, and there's charts and graphs you can keep, and so if you don't expose the egg and the sperm in the 7 to 10 day interval, then you're using time as a barrier on purpose to avoid such a thing. You can use a physical barrier. You can use a medication that stops you from ovulating. You can have an implant that stops you from ovulating for a couple of years, and you have to make some decisions before that last year. But you can't change your mind about that easily. We have to make an incision and cut it out of you. They go, "You have to cut me to get it out?" I go, "Yes, we do." They're so funny. They think it just goes in and, well, I suppose it could be something that dissolves over time. But everyone's shocked and very much upset that they should have to have an incision to remove it.
If you could do a tattoo with it.
Yes, and you're right. They often have very, very luscious tattoos, and I go, you can't tell me you're afraid of needles if you're covered with tattoos, but I keep my face plain. Say, well, let's talk about your body and how it works. And then I talk about the pus and the splinter. Nobody wants that after I tell them about that. So one of my roles is to help everyone, regardless of whether they've thought much about life issues, to understand their body better. And good medicine usually is also pro-life.
Okay, last question then. You've been at this a long time.
I have.
When you look at your patients, or you look even at American society generally, or perhaps this younger generation that's represented here, optimistic, pessimistic?
I'm optimistic.
And why?
But I'm an obstetrician. I specialize in happiness. I have never seen a generation as intelligent and well-formed and pro-life as our young people are now. You really have to be counterculture. But more young people are pro-life now than ever they have been. It drives Planned Parenthood crazy. They have meetings like how to evangelize young people to their point of view. Young men and women who look at biology and life and human rights, they make good decisions, and they'll keep making good decisions.
Well, thank you, and thank you for helping. Please join me in thanking Dr. Hersh.